And this comes after a separate executive order on Friday that included more big changes about who can get a COVID-19 shot in Florida and how.
Now, people under the age of 65 who are medically vulnerable can get their shot with approval from their physician. ABC Action News reporter Isabel Rosales speaks with a mom who is uncertain about the move and the reason the governor isn't anticipating any problems.
And he's for it.
Julie Dang is split over the news.
I see the pros and the cons of it.
Dang's adult daughter is high risk because of a genetic disorder and diabetes. And while she would benefit from this expansion, Dang worries about the supply. She's tried and failed to get her own elderly parents vaccinated.
I've gotten nowhere for the past 3 weeks.
On Friday, Governor Ron DeSantis quietly signed this executive order without public notification. It clears the way for those under 65 to get a shot at their local pharmacy or doctor's office, so long as their doctor sees them as extremely vulnerable to COVID-19.
This is a really, really important change for a community that's been left behind.
Florida Representative Carlos Guillermo Smith doesn't approve of the way the governor rolled this out, but thinks it is the right move.
Up until this point, it's not been a question of eligibility. It's been a question of access.
Previously, only hospitals were authorized to vaccinate those under 65 and high risk.
But what's happened in practice is hospitals have been mostly prioritizing patients in their own network.
So what do you need? To be eligible, your doctor must fill out a form by the Florida Department of Health stating you meet the eligibility criteria. And how about the supply Dang is worried about? Of Florida's nearly 4.5 million seniors, roughly half have gotten at least their first dose.
We're going to continue, obviously, to put seniors first.
The governor says thanks to the new vaccine on the way, an overall increase in doses, and the opening of 4 new federal vaccination sites in the state, he doesn't anticipate a problem. Dr. Jason Wilson says this next step makes medical sense.
This executive order, I think, moves us to push that envelope further and opening that door for even more vaccines.
Isabel Rosales, ABC Action News.